everybody. I'm Dr. Michael Nusbaum.
And I'm Dr. Daria, Klachko, Totten.
And welcome to
HealthTalks.
So today we're going to talk about dosing of semaglutide.
This is a really important discussion for me too, because I, going through my own issues with weight gain, came to my friend and colleague, Michael, for some help and guidance with it. I realized going through the menopause transition that the weight just started coming on and on and on, and I just had to go up and up in clothes. And when you're living this every day, you don't realize until I came to the office and stood on this scale. And I weighed as much as I did when I was pregnant with twins at 34 weeks, 6 weeks before my due date. And I said, oh my God, I really have to do something about it. So lucky for me, I was here with Michael and he really helped me lose some weight. So I kind of want to talk about my experience with the semaglutide and kind of talk about like what dosages do we use and how we use it.
So I think we should also talk about the difference between semaglutide and tirzepatide in relation to dosing.
Okay.
I think it's an important thing to also touch upon. So with semaglutide, you do want to start at a low dose and steadily increase the dose to the point that you are not hungry. Now we use insulin syringes, so the dosing you're familiar with is actually units on an insulin syringe.
Absolutely.
So we typically start at 10 units on the insulin syringe, and then maybe go to 20, and then go to 25, and we steadily increase it to the point that you are not hungry. You do not increase the dose to the point that you're nauseous or you feel sick. That means you went too far, you gotta back off. There is no reason to be nauseous on these medications. That actually means you're taking too much.
All
right. It just really should be to the point that you're not hungry. And I think you had mentioned you had gotten up to like 25.
I really started to notice the effects pretty rapidly. And I really I don't think I went over even 28 units. I kind of pushed it into that and it worked great. I mean, I was able to really get rid of the cravings, which, it really drives you crazy
and
to be always hungry.
Right, and that is really a titration. That's a titration endpoint to feel like you're not hungry. So if you're still getting cravings, so let's say you take your dose on a Friday, your next dose is the next Friday. The medication should suppress those cravings until your next dose.
Yeah, and it absolutely did.
Correct. So that means you were on the right dose.
Yes.
All right. Now, some people come in, they say, well, Thursday night I'm starting to get cravings, I'm starting to get hungry. The dose isn't high enough yet. And that's where you could go from 20 to 21 or 22 units. You can fine tune it. That's one of the beauties of using an insulin syringe as opposed to an injectable pen. You could really fine tune exactly how much semaglutide you're getting. Now, some people do say, and even at lower doses, that maybe the first day or two they're nauseous. And that can happen. Did you experience that at all?
I certainly did. I got a little nauseous from the beginning, but with time it definitely got better.
Okay.
So.
Yeah, and look, that can happen. That is not an endpoint to stop titration though. So if you're on a semaglutide and maybe the first day you're feeling like you have a cold or like you're just sick,
achy or a little weird,
that can happen. But like you said, it does go away with time, especially as you're on it a little bit
with
longer.
a lot of medications too, it's like you gotta let your body get used to it.
Right.
What dosages, like what's a normal amount of dose? Like what do you see? What's the range? Is there too much like that you could take?
Yeah, that's a good question. I mean, there are definitely some patients who are very resistant to the medication. I've had patients go 100 units.
Wow.
On an insulin syringe. So that's a lot.
Is that dangerous?
It's a good question. We could also talk probably another episode about risks and contraindications for semaglutide. But I would say that if you're going really, really high, one of the risks is pancreatitis, and you probably want to be really careful when you start climbing up on the dosing of a semaglutide.
Again, that's why you need to see a professional to help guide you through it.
Don't do it online.
Don't do it online.
I know you got telehealth visits, but you really need more than that. So in comparison to a tirzepatide, tirzepatide is a GLP-1 agonist, but also GIP agonist, so it has more effect on the intestines in addition to the stomach. So semaglutide is really just affecting your stomach and satiety, so it's decreasing gastric emptying. But the tirzepatide does both that and the intestinal decrease in motility. So
does that increase risk of constipation?
It does, and even bowel perforation actually is something we've actually talked about with that. So you do have to be careful. But the dosing on a tirzepatide is different because now you go for 4 weeks on one dose, and then you go up for the next 4 weeks.
Okay.
So that necessarily isn't the best for some patients. Some
Right.
patients want to see results right away, and
Right.
the
And
dosing.
you also can't undo it once it's in.
Right, and that
like,
dosing for the
4
first
weeks.
month may not be enough. So you might be
Yeah.
very frustrated with the
Right.
tirzepatide saying, I didn't really
Wow.
feel anything for that first
Wow.
month. So those are kind of the differences. We've talked about that in the past, and we
Yeah.
can certainly talk about it again. If you guys want to hear more about it, just let us know. We're happy to do that. But yeah, I think when it comes to dosing of the semaglutide, you want to titrate up to the point that you are not hungry, not up to the point that you're nauseous or you feel sick.
Okay.
That means you just went too far.
I have a question because it sees like personally and with other people that I know that have been on the weight loss program. Once they stop the meds for a while, they finish the program, you've lost the 25, 30 pounds that you wanted to lose, and then you kind of say, you know what, I want to start it up again, because now I feel like I didn't change my diet, I didn't do the right things, now I got to go, want to go back on it to lose maybe another 10 pounds.
Sure, absolutely.
It doesn't seem to work as well.
Yeah. There's no evidence that there's resistance build up to semaglutide. Medications like phentermine certainly have that, and that's mostly because medications that are cleared by the liver, your body kind of gears up those enzymes on the smooth endoplasmic reticulum to actually detoxify your body. And so alcoholics have the same thing too. When you're drinking alcohol, the more alcohol you drink, your body becomes more efficient at processing the alcohol. So that's definitely something that happens with some of the other weight loss medications. It's never been shown to be the case with any of the peptides.
Okay.
And you gotta remember too, semaglutide, tirzepatide, they're peptides. They're just a series of proteins that mimic something we already produce in our body. They're not hormones. That's probably another topic we should talk about, that they're not hormones. Some people think you're injecting yourself with hormones. You're not. It's just a peptide. But no, there's no evidence to show that there is a resistance that can build up over a period of time. But I would say that, once again, you need to titrate to the point you're not hungry.
Right.
Wherever that happens to be, that's where you need to go.
Okay.
All
All right. Take home message.
Absolutely. And if you are getting your medication from an online pharmacy or a doctor or somebody who's not a weight loss specialist, please don't do that.
Yeah, go get followed, get monitored, get counseled, have somebody watch you, and make sure you're doing it right.
Look, when you pick doctors, it comes to experience and knowledge. And if you have a doctor who specializes in something other than weight loss, it's unfortunately not the right doctor.
And have a plan afterwards, because
100%.
once you come off, if you go back to your old habits, you're going to gain weight back again.
And what did you do?
Yeah.
You gained weight just to yo-yo and go back. So
Yeah.
you want a comprehensive program with registered dietitians. We're going to come up with a plan for you so that when you're done, you don't put the weight back on.
Yeah.
As always, I wish you guys the best in your weight loss journey. I'm Dr. Michael Nusbaum.
Dr. Daria, Klachko, Totten.
And thanks for joining us at
HealthTalks. Bye.
Bye.